So here are the types of things that we test for. Acuity, everybody gets the test for how well they can see down on the chart and whether or not they need glasses. And I'm not dumbing down the fact that we need to prescribe the right thing. That's where we always start. So before anybody ever does a visual perceptual evaluation, they have the general developmental exam first. Eye posture, that's typically, are the eyes aligned at the same place? We talk about eye health.
Go ahead. I'm sorry.
It's okay. And now, the ones that are highlighted in red are not typically done in a regular exam. Sometimes they are, sometimes they're not. Depends on where you go. Depth perception, eye movement, motility. So in a general exam that's not developmental, it's a very cursory, can you move the eyes in all different directions, and does each eye move fully? So, but when we're looking in a developmental exam at eye movement, we're looking at how well can a person fixate and hold at one place. How well can they make a cicada movement? It's a jumping type movement that we use in reading. And how well can they make a pursuit movement? And there's lots of different ways to test that. Focusing ability. So are you able to look at something up close and get it focused well, and then quickly look at something far away and have it focused, and every dynamic in between? And binocular skills or teaming skills. So now we have let's say the two eyes are pointing at the right place. If I put visual stress on the system, do the eyes suddenly get blurry or go into two? And how long can they keep clear and single? And there's ways to test that. And for all of these, we're looking for clarity, speed, endurance, flexibility, and strength. And then convergence. And convergence is simply being able to bring the eyes close to the nose without going double. And generally, if somebody has a good visual system, they should be able to converge all the way pretty much to their nose, within like an inch or two of their nose. If they can't, either they will go double, or often they won't go double, but the eye will just stop tracking. One of the eyes will stop tracking. And that is a huge problem with people that have learning disabilities, because if that's happening when you read, you're going to go double. The interesting thing about convergence is about 3 years ago, they started a study called the Convergence Insufficiency Treatment Trial. And it was a study that was funded by the National Institutes of Health, and it involved ophthalmology and optometry. And what they found was they did a controlled study that had a placebo group, a group that did therapy that wasn't vision therapy, and a group that did vision therapy. And in-office vision therapy by far exceeded the results of any of the other groups. Now they're on their second phase study, and what they're doing is they're taking the kids that are treated with vision therapy and convergence insufficiency and relating it to actual learning and reading skills. So they absolutely have a connection there. And then they check a peripheral vision as well. So when we put stress on the system, a lot of these things fall apart. So what could be visual stress? Anybody want to say anything? What do you think visual stress might be?
Low lights or bright light.
Okay, that could be one.
Too much other stimulus around.
Absolutely. So a lot of distractions.
Doing it for a long time.
Yes. How about taking a test? How about having a cold? So there's a lot of different things that can cause stress to the visual system. So when we talk about processing, there's all kinds of visual processing that we use. But if you look at how we process, it involves a lot of things like past experience. It involves our motor skills, how we developed as a baby. Our balance system and our vestibular system is all connected to that. Very often patients that have had insult to the brain like a stroke or brain injury surgery, something like that, very often their visual system is very unbalanced. And they don't know necessarily that it's their visual system. And that's why I get a lot of referrals from occupational and physical therapists, because what happens is they're kind of like walking like this. And sometimes with lenses alone, we can make huge changes with that. Also, we're talking about our auditory visual integration, our sense of rhythm, and perception of size, form. Figure ground would be like the Where's Waldo, trying to find some detail in a very conflicting environment. Sequential visual memory, and the form constancy. So when we have good vision, when we have good visual input and good perception, then we get good learning, and it helps us with our reading and our writing, comprehension, spelling, mathematics, and visualization. Visualization is huge because that is the highest form of our ability to see. And a lot of the kids, they can't go into geometry because they cannot figure out how to manipulate things. And that's part of what we do in vision therapy too, is help kids with that. And then of course behavior.